The Boise Police Department has been staffing a mental health coordinator to respond to calls with officers for the past 6 years. And lots of times those calls come from people who might need some sort of help but don't know where to go. As we know, mental health is a topic many people are thinking about as we process the tragic shooting at the mall Monday. Officer Blake Slater joins us now to talk about how we can support each other right now. Officer Slater, thank you so much for joining us.
Thanks, Shira, for having me.
So how can people support one another right now, especially during this time?
So, Shira, it's been a rough week, so I want everybody to take a chance to reach out to their loved ones, reach out to their coworkers, and just check in with them. Send a text, reach out to them on social media, and take some time to yourself just to reevaluate how you're doing emotionally, mentally this week. I want to echo what the police chief and the mayor also said earlier in the week. Just check in with the shopkeepers, co-workers, and that kind of thing.
And can you tell us more about your role with the police department and how it all came about?
You bet, Shira. So 6 years ago, we hired a mental health coordinator based on the calls for service. And as that calls for service increased, we hired an additional mental health coordinator and 2 police officers to do real-time follow-up and in-person face-to-face contact with folks in crisis. So as those calls increased, our goal is to divert folks from calling emergency services and 911 to more appropriate services within the community. So we've been pretty effective going out and following up on every person that calls 911 as a crisis call in a goal to redirect those folks to another agency.
I imagine training comes along with this. What kind of training does this entail?
Absolutely. So training is important here at Boise Police. Every police officer receives the crisis intervention team training. It's a 40-hour block of instruction that we've modeled after the Memphis, Tennessee model. So we focus on de-escalation techniques, community capacity building in order to get those folks good positive interactions with the police department and provide them services outside of law enforcement.
Could you give us some examples of the types of calls that you receive or respond to typically?
Absolutely. So sure, because we're a follow-up unit, our goal is to go out and meet face-to-face with each person that creates a crisis call of service. So we want to make sure that we go out and follow up, make sure that that person that has mental health needs gets addressed, and we get them a resource or get them an appointment with a resource as soon as we can. We also provide real-time follow-up in person for folks that are actively in crisis or actively psychotic.
You just mentioned resources, and I know a lot of people are probably listening to this right now. What resources are out there for people who might be needing some professional help for themselves or maybe a loved one?
You know, Shira, we're very fortunate to live here in Boise. We have a lot of resources available to us here in the Treasure Valley. So as the mayor mentioned earlier this week, BPA Health can be reached at 800-726-0003. You can also reach out to the Idaho Suicide Prevention Hotline. Their number is 208-398-HELP. You can send them a text. We also are super fortunate to have a couple of crisis centers here locally. So Pathways Community Crisis Center is right over off of Cole and Emerald at 7192 West Potomac. And there's also one in Caldwell, the Western Idaho Community Crisis Center. All of those folks are staffed 24/7 that you can walk in and get real-time face-to-face care with mental health professionals.
All right, a lot of good resources there. Officer Slater, thank you so much for taking the time to talk with us today.
Thanks, Shira. Have a great day.
You as well.